Hi everyone, my name is Nikita Dcruz and I work as a pediatric physiotherapist at Ummeed Child Development Center. Today I will be sharing my understanding of the ICF Framework, which stands for the International Classification of Functioning, Disability and Health. This framework was created by the WHO in 2001 with the hope to give us all professionals a standardized and uniform language to describe functioning or disability for a person. The objectives of today's sharing would be to be able to understand the ICF framework from a pediatric and an adult perspective, and to be able to understand how to use the ICF framework for goal setting and creating home programs for clients. How is the ICF different? So the ICF speaks about disability as being something that is internal to the person, which would include factors such as the disability or the disorder itself, and factors that are external to the person, such as the environment, which would influence the person's disability or the diagnosis. So earlier we had the medical model, which spoke about the problem of a person caused by the disease or the trauma or the health condition, and it required medical care provided by an individual or a healthcare professional. Another model that was used was the social model, which identified the disability as a complex condition created by the social environment that prevented a person from integrating into the environment. Thus, the ICF is actually a biopsychosocial model which aimed to integrate or to combine both the medical model, which was heavily focused on the disability or the disorder being caused by the body structure, and the social model, which spoke about the personal factors and the environmental factors that influenced a person's disability or the diagnosis. So, we understand that the ICF speaks about the interaction of the disability and the environment's influence on the disability itself. Moving on, let us understand each category within the ICF and look at all of these categories and the framework itself. So firstly comes the health condition, which is the diagnosis, the disease or the disorder that a person has. Let us take an example to understand this. In our example, we would possibly have a lady who is 60 years old and is experiencing frozen shoulder stage 3. Here, the frozen shoulder is the diagnosis for this person. The ICF then has two large components. The first being functioning and disability, and the second component is the contextual factors. Breaking down the larger component of functioning and disability, it has three main categories within it. The first category is the body structure and function, which is defined as the anatomical part, which is the body structure, and the functions would be the physiological functions of that body part. So going back to our example, the anatomical part affected would be the right shoulder, and the function affected would be reduced range of motion at the shoulder or the thoracic spine, or altered posture, or maybe slight pain at the shoulder, or muscle imbalances around the shoulder, which could be the tightness of the upper trapezius, the levator scapulae and the pectorals. But there could also be weakness of the rotators of the shoulder along with the scapular retractors and the depressors. The second component is activity, which is understood as the execution of a task or an action. Drawing back to our example, an activity for this lady could be grooming, where she is expected to wear her blouse and comb her hair. The third component could be participation, which is defined as the involvement in life situations that are meaningful for a person. So for this woman, perhaps going to a supermarket to buy vegetables and to use these vegetables to cook food is something that's really meaningful to her. To do this, she has to be able to perform the activity of grooming, but also needs to be able to perform other activities such as walking to the supermarket, carrying a bag of vegetables on her shoulder and cleaning those vegetables, or so on. Thus, summarizing the component of functioning and disability, this component has three large parts: the body structure and function, the activity, and the participation. Moving on, the next category is the contextual factors. The first component here is the environmental factors, and this includes the physical, social, and the attitudinal environments in which people live. This could be a barrier or a facilitator for the individual experiencing difficulty. Drawing back to our example, let us see how this fits. The lady herself could be apprehensive about movement, and this could be a attitudinal factor that was a barrier towards her being able to perform the movements at the shoulder. Another such factor could be that she, being from an urban city like Mumbai, would be well equipped with her understanding of how to use the mobile phone or how to use the internet to get access to resources about her condition. And maybe she would have a social circle of friends where the condition could be fairly common, or she would be able to discuss this with her friends, and so her understanding of the condition would evolve. This understanding would directly influence her symptoms or her understanding of the diagnosis of the disease. And all of these factors, all of these components come largely under the umbrella term of attitudinal environment. For the social environment, it could perhaps be the relationships that this lady has with her husband or family, with her neighbors, or even with the therapist that would influence the condition or the diagnosis. Coming back to the physical factor, for this lady, it could possibly be wearing a loose blouse that would help her to wear the blouse easily, or combing her hair with her other hand. And these changes in the physical environment were important or were helpful for her to be able to complete her daily task. Also, the use of heat modalities or any other medication that would also aid treatment would fall under the large category of physical environment. The design of the house, which would include cabinets and cupboards, which could be a barrier or a facilitator based on where they were placed in a house, or even the gadgets that she used to get access to the information, would form a part of the physical environment. The next contextual factor would be the personal factor. The personal factor basically involves the race, the gender, the lifestyle, the habits that are unique and specific for this person. So, for example, this lady could be just living with her husband, and maybe that is why cooking food for her family or for her husband specifically would be something that is really important and meaningful to this person, which would be a personal factor. Now, what's really important to understand that these are the individual categories of the ICF. But what the ICF framework does is that it establishes a dynamic relationship between all of these categories. So, all of these categories are able to influence each other in multiple ways. For instance, let us take the example of this lady who has a frozen shoulder stage 3. Now, this lady enjoys going to the supermarket with her friends and buying vegetables. However, because she is living in Mumbai, she would possibly be well knowledge about her condition and may also experience apprehension on movement while moving her painful shoulder. These could be the attitudinal factors for the woman. But she could also be using strategies such as combing her hair with the other hand or wearing a looser blouse, which would help her groom herself and go to the market with her friends despite having a frozen shoulder. In this way, we realize that each of the individual components seem to have a dynamic relationship with each other and influence each other, so that this lady could possibly go to the market and cook food for her family members. So this would be the ICF framework for this lady that we have spoken about, who is 60 years old and who likes going for walks and to the supermarket with her family and friends. Using this example, let us move ahead to that how the ICF would be used for treatment and home programs. Since this is a stage 3 frozen shoulder, the home program would initially involve daily tasks such as pushing the trolley in the supermarket, which is an example of a closed chain exercise for the shoulder and the arm. This would help in the activation of the scapular muscles and the rotator muscles of the shoulder. It later can be progressed to the woman wiping her kitchen top, where the height of the kitchen surface is appropriate and the woman is now performing a modified closed chain activity since her hand is moving at a distal level but her shoulder and trunk that are at a proximal level are relatively stable. Finally, the home program could incorporate activities such as active reaching out by the woman to different objects such as containers or utensils which may be placed above in cabinets or below the platform. This is an example of an open chain activity for the shoulder and it emphasizes on the movement of the shoulder in appropriate ways during the last stages of rehab. So we see here how the ICF could be used to create a unique home program using simple everyday tasks that this lady enjoys. Moving ahead, let us take another example. Here, Aryan is a 11-year-old child diagnosed with cerebral palsy, spastic quadriparesis, and receives therapy on a weekly basis. Aryan is a very happy child who enjoys playing and interacting with his family and friends from his school and the neighborhood. He enjoys helping his mother around the house, especially by setting plates for everyone during the meals and taking off the lid of the utensils during meal times. However, Aryan, having cerebral palsy, experiences higher tone in the left side as compared to the right, and this influences his sitting posture, his grip, both his hand movements, and muscle coordination. Aryan is able to walk with his mother's support but has difficulties in scooping food into the spoon. This creates a barrier for Aryan to be able to enjoy meal times with his family. The personal factors would involve the factors that Aryan really enjoys or likes or dislikes that would help him to form the certain skills that were needed to perform the activities that were needed during meal times. Moving on, the attitudinal factors for this particular case would be that Aryan being a child who enjoys meal times but would get really frustrated when he was unable to scoop the food into the spoon. For the family, it was important that Aryan found independence in the meal times because the school did not allow the caregiver to feed the child during break times. And this was where the attitude of the school or the emphasis that the school should learn this skill, that the child should learn this skill to eat independently was important. Thus, all of these factors come under the large umbrella term of attitudinal environment. The support system that would possibly help Aryan learn these skills for independent feeding included his relationships with his family, his friends in school and the neighborhood, his therapist and the school teacher. Lastly, there were certain changes in the physical environment such as the use of curved spoons, the plate with curved edges or the AFO that helped Aryan to improve his posture and his alignment and thus helped him in learning the skills that were needed to learn independent feeding. In this scenario, we were able to understand that the use of ICF was to be used in goal settings along with the individual and the family. The ICF helped us understand what was really important for the individual and the family at a very basic level. It helped us come to the participation goal, but it also helped us to understand what were the attitudes or the social requirements for the family and the child, which helped us to arrive at the participation goal. The ICF was able to build on ideas that were specific for the individual, such as Aryan enjoyed being a part of the meal times. Aryan enjoyed setting up the plates, removing the lids of the utensils, and these were specific to Aryan. But it helped us to form a goal for this family and for this child. Moving ahead, we could also see the dynamic interaction of the components to work on the disability or the disorder. For example, the therapist used certain personal factors that were unique to Aryan, such as playing with his friends to work on his sitting posture or activities that required muscle coordination. Or she could have used the physical adaptations such as modifying the utensils or use of AFO that influenced his posture, thereby influencing his participation, or how he involved himself in meal times. And these were the steps that were useful for the goal setting discussion. These were certain references that were really helpful while making this presentation. Thank you.